Last year in the United States alone, over 500,000 gallbladder operations were performed. Gallbladder operations are performed to remove a diseased gallbladder. The purpose of the gallbladder is to store bile, and bile is then released from the gallbladder into the stomach for digestive purposes. When the gallbladder is diseased, the doctor has a choice of removing the gallbladder by using a laparoscopic procedure. And over 85% of the gallbladder operations that are performed during this laparoscopic procedure. A laparoscopic procedure involves the surgeon placing 3 small incisions in the patient's abdomen, and then by using laparoscopic instruments, the doctor can actually go into the person's abdomen, locate and identify the gallbladder, and then remove the gallbladder. Oftentimes, recovery for laparoscopic gallbladder operations is 1 to 2 days. Medical malpractice during gallbladder operations occur usually when the surgeon does not properly identify the anatomy before he decides to clip and cut. And we have an illustration here that shows the location of the gallbladder in the human body, and the gallbladder is attached to the common bile duct by the cystic artery and duct. During a gallbladder operation, the doctor is supposed to place a clip on the cystic duct and the cystic artery, and then cut the cystic duct and cystic artery, and then remove the gallbladder. During gallbladder operations, where the doctor fails to properly identify and cut the cystic artery and cystic duct, an unintended injury usually occurs to the common bile duct. The doctor often will place a clip on the common bile duct and then cut the common bile duct at this location. When that happens, the bile that's produced by the liver cannot flow down through the common bile duct and into the stomach. Bile then backs up in the patient's liver, the patient becomes jaundiced, and the doctor then has to perform another operation to reconnect the bile duct so the bile can flow from the liver into the stomach. If at the conclusion of your operation you find that you have a 6 to 8 inch incision on your abdomen, and when you ask your surgeon what happened during the operation, and the surgeon will not describe any specifics of the operation, but simply tells you that there has been a complication and he had to convert to an open procedure, you should seek legal advice. Most doctors won't tell their patients they committed medical malpractice. Most doctors will not admit to the patient that they clipped and cut the wrong duct in your body. Also, if at the conclusion of your gallbladder operation you have drainage tubes that are placed in your body to drain the bile, this should send up a red flag, and you should also seek medical advice. Now, not all injuries to the biliary system that occur during a gallbladder operation are the product of medical malpractice. However, if you suspect that something went wrong during your gallbladder operation and your doctor has not been forthcoming with a detailed explanation of what happened during that operation, you can call any of the attorneys at Miller at Zois. We will obtain your medical records from the hospital. We will review the medical records. We will also have the medical records reviewed by a board-certified surgeon. And based upon our consultation with our experts, we will be able to provide you with an opinion whether the doctor and we believe that your surgeon failed to follow the standard of care in performing your gallbladder operation, and we will gladly represent you in a court of law and try to obtain fair and just compensation for the injuries, the pain, and suffering that you went through as a result of medical malpractice by your surgeon.